Welcome to the Deep Dive. We're the place where we take your source material, really break it down, and pull out the most compelling insights.
That's the goal.
And today, well, we're diving into something pretty fascinating. It's a real historical intersection.
Hmm.
How the Rockefeller Foundation's huge medical philanthropy effort in China back in the early 20th century was really profoundly shaped by the Christian faith of its founders.
Exactly.
Yeah.
Yeah, we've gone through several key articles, research notes, really trying to pin down that specific connection.
Okay.
So our mission today is, to unpack how the Foundation's pretty deep-rooted Christian beliefs actually translated into these quite groundbreaking efforts to modernize healthcare, public health all across China.
Right.
It's really about exploring the specific ways that faith didn't just influence things, but actively drove such a massive undertaking.
Okay, let's get into that. Because when you think Rockefeller Foundation, you often think, huge wealth, global problems. But these sources we're looking at, they really make it clear this wasn't just generic goodwill.
No, not at all.
For John D. Rockefeller Sr. and the whole institution he set up, this philanthropic drive, it seems, was inseparable from his Christian faith.
That's exactly it.
Yeah.
John D. Rockefeller Sr., he was a devout Baptist.
Yeah.
And the core of his belief, really, was that his considerable wealth wasn't just his. It was like a sacred trust from God, given to be used for God's purposes, to serve humanity.
Okay.
He actually famously said the purpose of money was to make everything else better. And that wasn't just talk. It was a really deeply held conviction. And it directly shaped where the foundation put its resources, places like medicine, education, where the potential to improve human lives, well, on a massive scale, was just clearest.
So it wasn't just some vague charitable feeling. The sources seem to stress they actively looked to specific biblical teachings to kind of guide the work.
And they absolutely did. And this is where the connection gets really concrete and insightful, I think. Think about the sheer scale of the medical need in China back then. I mean, rampant infectious diseases, such limited access to modern care.
Right. Huge problems.
Huge. And their motivation to step into that massive challenge, it was deeply tied to commands like love your neighbor as yourself, from Matthew.
Okay.
And that powerful message of compassion in the parable of the Good Samaritan from Luke. For them, this wasn't just about helping someone, down the street. It was a real call to action. Provide medical aid, public health support to people suffering literally halfway across the globe.
So applying that core idea of neighborly love universally, distance didn't matter.
Precisely. And beyond just that, the belief drawn from John 3.16, God so loved the world, gave them the sort of underlying theological basis for extending medical help to everyone.
Right.
It reinforced this idea that every single human life has inherent dignity, is worthy of care. And that's a pretty powerful foundation for global health initiative, wouldn't you say?
Absolutely. That dignity of each person being a core driver. So what other teachings shaped how they approached it?
Well, the whole concept of giving itself was seen through a spiritual lens.
How so?
Like give and it will be given to you from Luke.
Yeah.
That wasn't just about personal reward. It was seen as reflecting a divine principle that's just inherent in the act of philanthropy itself.
Okay.
And the golden rule from Matthew, in everything, do to others what you would have them do to you. That directly informed the standard of care they were aiming for. They weren't offering second-best solutions. They were really striving for medical excellence, comparable to what they'd expect for themselves.
So showing respect through the quality of the service, setting that high bar as an act of treating others properly.
Exactly. That's a good way to put it. And then there's the principle of sharing knowledge, sharing resources, which is so crucial for any kind of sustainable impact. Right?
Yeah, definitely.
And that lines up perfectly with Matthew 10.8. Freely you have received, freely give. This wasn't just about, building buildings. It was fundamentally about sharing the best medical knowledge, training people locally, empowering them to carry the work forward.
Right, building capacity.
Yes, and this whole idea of serving others, even, to the point of ultimate sacrifice, like in John 15.13, that resonated with the kind of dedication required from healthcare professionals. It was a spirit they really sought to embody and also to cultivate in the people they trained.
Connecting the day-to-day grind of doctors and nurses to that really profound call to serve. And the sources even link this to something broader, like social justice.
They do, yeah. The work to alleviate suffering caused by widespread disease, lack of access to care, that was seen through the lens of Isaiah 58.
Okay.
which talks about, breaking the yokes of oppression, loosening the chains of injustice.
Right.
So providing access to health, freeing people from the burden of, say, debilitating illness, that was viewed as a form of promoting well-being, promoting social justice. It aligned their medical mission with a bigger call for human flourishing.
That really provides a powerful framework for what they were doing. It wasn't just about treating sickness, was it? It was about tackling these systemic issues, suffering, inequity, and rooted in their faith.
Exactly.
So how did these, well, profound beliefs actually manifest, like in concrete actions on the ground in China? What were the key projects?
Well, the most prominent example, the one that really took up a significant chunk of their resources and attention, that was the Peking Union Medical College Hospital. PUMCH, as it's known.
PUMCH, right. Still a huge leading institution in China today. Its history must be quite something.
Oh, it is. And the foundation, they didn't start completely from scratch there. They actually acquired an existing medical institution back in 1915,
Oh, okay.
one that had been founded by a coalition of British and American churches. So in a way, you could say they were building on an existing foundation of Christian medical mission work that was already happening in China.
Building on it, but I'm guessing scaling it up
Right.
dramatically.
Dramatically is, yeah, probably an understatement. The sources highlight an investment that's equivalent to billions of dollars in today's money.
Billions, wow.
Basically, to rebuild and develop PUMCH, almost from the ground up. Their goal was incredibly ambitious,
Which was?
to create a medical center in China that was genuinely world-class, on par with the top hospitals, top medical schools in Europe, in the U.S.
Okay.
And this meant bringing in the absolute most advanced equipment, implementing really rigorous Western scientific teaching methods, and critically focusing heavily on training the next generation of Chinese medical leaders.
Sounds like they weren't just aiming to, like, treat patients temporarily, but really establish a self-sustaining hub of modern medical excellence.
That's exactly right. And a key aspect of the care they emphasized at PUMCH, which reflects those Christian principles we were talking about, was this idea of holistic care.
Holistic care.
Or as the Chinese term puts it, hu, basically, healing body and mind.
Healing body and mind. That sounds, pretty advanced for the early 20th century. How did they actually do that, practically?
Well, the sources point specifically to the establishment of a dedicated social service department at PUMCH.
Social service department.
Yeah, which apparently wasn't standard practice even in Western hospitals back then.
Really?
Yeah. And this department, it went beyond just dealing with the physical symptoms. It focused on the psychological needs, the social needs, even the economic needs of patients, particularly those from, poorer backgrounds who faced huge barriers to getting healthy and staying healthy. This was really a direct embodiment of that Christian call to care for the whole person, recognizing that health isn't just, the absence of disease.
That's a remarkable detail. It really shows how deeply their values shape the kind of care they wanted to provide. So beyond the hospital walls, what about tackling public health challenges on a bigger scale?
Yeah, they saw the massive impact of these widespread infectious diseases in China as just a critical area for intervention. Another clear application, really, of that principle of serving the most vulnerable.
Right.
Their public health initiatives were just as significant in many ways as the hospital project itself.
Are there specific examples of the impact from the sources?
Yes. One really prominent example is their work on hookworm prevention and treatment.
Hookworm, right.
Nasty stuff. Yeah, debilitating, widespread, really hit productivity and health hard, especially in rural areas. The sources highlight the dramatic success of their project here. They note they helped increase cure rates from basically
0%.
Pretty much, yeah, up to an impressive 82%.
Wow, 82%. That's a concrete example of really alleviating suffering. A truly impactful statistic. Shows the power of that targeted public health work.
It does. And their approach wasn't just about specific diseases either.
Yeah.
They also provided crucial support for developing models for rural healthcare. They backed something called the Dingxian Rural Health Model. The aim there was to create these low-cost, accessible healthcare networks designed specifically for the vast rural population.
Right.
This model was, well, quite pioneering, and it served as an important prototype for China's later national rural medical system development.
So thinking about solutions that could actually scale for the majority of the population, not just, an elite hospital in the capital city.
Precisely. And they also supported institutions like the Central Epidemic Prevention Bureau,
Okay.
which was the direct forerunner of what's now China's CDC, the Center for Disease Control. And that support was crucial for developing capacity in areas like vaccine development, infectious disease control, but at a national level, really laying essential groundwork for public health infrastructure.
It sounds like a really multi-pronged strategy then. Build a world-class institution, tackle major diseases with specific programs, and support national capacity in rural models.
Yeah, that covers it well.
And underpinning all of this was that crucial element of education and training you mentioned earlier.
Absolutely. That commitment to education, to sharing knowledge, it wasn't just like a side component. It was fundamental to their long-term vision.
Right.
They set up programs to fund Chinese students so they could study at the best medical institutions abroad, bringing back that cutting-edge knowledge.
Mm-hmm.
And they also brought international experts to PUMCH to teach and train the staff there.
Facilitating that knowledge transfer kind of both ways.
Yes, exactly. And this directly embodied that biblical instruction we talked about, freely you have received, freely give.
Right.
Their goal wasn't just to run a hospital forever, you know. It was to cultivate a generation of highly trained Chinese medical leaders, leaders who were equipped not just with the technical skills, but also with that same spirit of service, that dedication that motivated the foundation itself.
It's really striking how consistently these operational decisions seem to tie back to those stated faith principles. But the Rockefeller Foundation wasn't the only group driven by faith doing medical work in China then, right?
No, that's a really important piece of context. The sources do mention Nanjing Gulu Hospital as another example.
Gulu Hospital.
Yeah, founded back in 1892 by an American missionary doctor, William E. Macklin. It was actually one of the earliest Western-style hospitals in China.
And this one wasn't directly funded by Rockefeller.
Correct. The sources are clear on that. Gulu Hospital didn't get direct Rockefeller Foundation funding.
Okay.
But its history really exemplifies that broader movement of Christian medical missions in China that existed alongside and in some ways informed Rockefeller's later much larger scale work.
Right.
Macklin, for instance, he explicitly operated on the principle of medical missions, or
It means.
basically using medical treatment, using healing as a means to build trust, build relationships, which could then, open doors for sharing the Christian message.
Ah, I see. So medicine as a kind of bridge for missionary work, which sounds related to Rockefeller's motivation, but maybe a slightly different approach.
There is a nuance there, yeah.
Yeah.
While Rockefeller's initial acquisition at PUMCH was from church missions, the foundation itself, especially after taking full control, deliberately kind of toned down the direct evangelistic activities at PUMCH.
Okay.
Their focus became much more purely scientific, medical, public health work. However, and this is what the sources emphasize, this didn't mean abandoning the underlying Christian humanitarian spirit.
So how was that spirit kept alive or transmitted if the direct religious stuff was less emphasized?
Well, it was transmitted through the practice of medicine itself.
Through the actions.
Exactly. Values like love your neighbor, this idea of benevolence and saving the world,
Yeah.
and that fundamental call to serving others. They were embodied in the quality of care, the dedication of the staff, the holistic approach we talked about, the commitment to public health. It was demonstrated through action rather than, say, overt preaching. There's a powerful moment mentioned in the sources, actually. John D. Rockefeller Jr.'s speech at the 1921 PUMCH inauguration.
Yeah. What did he say?
He emphasized that Western medicine would only truly succeed in China if it was accepted by the Chinese people. He said it must be freely offered and cordially accepted.
Why is that particular point seen as so significant in relation to their faith?
Well, the sources link this idea, perhaps metaphorically, to the Christian concept of incarnation.
Incarnation.
The idea of the divine becoming human, entering the world in a way that was relatable, accessible. Applied here, it meant the Foundation's work wasn't about just imposing foreign knowledge from afar.
Right.
It was about trying to incarnate Western medicine within the Chinese context, offering it with respect, with humility, with a spirit of service that would make it understandable and hopefully acceptable to the people it was meant to serve. It was quite a strategic approach, but one deeply rooted in their theological worldview.
That's a really sophisticated way to think about their method, not just, a tech transfer, but an effort to integrate it through service and respect.
And that spirit, the sources argue, has actually endured. Both PUMCH and Gulu Hospital today, they continue to uphold principles like benevolence and saving the world. They still see their medical service as intertwined with humanitarian care. This lasting commitment to serving others, often under really challenging circumstances, it's seen as a direct legacy of those Christian core values that founded and shaped these institutions.
And PMCH's current status, I mean, it certainly speaks to the strength of that foundation, doesn't it?
It really does. It's still a leading hospital in China, very highly ranked. It played crucial roles, even recently, like during the COVID-19 pandemic.
Right.
The sources suggest that the excellence, the dedication you see there today is, at least in part, a testament to that initial foundation, that combination of rigorous scientific standards and a profound spirit of service driven by faith. The willingness of healthcare professionals to serve, sometimes even at great personal risk, it resonates with that deepest call to serve others.
This deep dive has really illuminated just how deeply intertwined faith and this kind of large-scale philanthropy were, specifically in the Rockefeller Foundation's work in China. It was clearly far more than just funding. It was really a mission grounded in a specific worldview.
It absolutely was. There's significant medical philanthropy in China. It wasn't simply a result of, having the resources. It was fundamentally motivated, fundamentally shaped by their Christian faith, translating those core values into tangible actions that established major institutions and truly impacted public health on a national scale.
So for you, the listener, thinking about this powerful historical example, faith-driven philanthropy in global health, it does raise a broader question, doesn't it? What role do you think underlying values or beliefs, whether they're religious or secular or something else, what role do they play in shaping humanitarian efforts, shaping international cooperation in the world today?
It's definitely a lens worth applying when you look at global initiatives, both past and present.
Indeed. Well, thank you for joining us for this deep dive.